Hi guys, welcome to our YouTube channel Nursing Update. So this week we will see MCQs related to obstetrics and gynecology. So today's our first set of MCQ on obstetrics and gynecology. So if you take exam point of view, if you see any of the question paper all over India, so you can see maximum 20 to 30% of questions from this particular topic. Okay, so in previous days, means before 2016 and all, this was a less important topic, but nowadays it's one of the most important topic. If you compare this obstetric and gynecology with medical surgical nursing, the more the questions are coming from obstetric and gynecology. Okay, so let's start today's video. So if you are new to our channel, please subscribe our channel. Okay, let's move on to the first MCQ of today's video. Okay, so first MCQ is purple discoloration of vaginal mucosa in pregnancy is known as. Okay, so if you see physiological changes in pregnancy, it's one of the vast topic. Okay, so in that vast topic, the most important points are this signs. Okay, leave obstetrics, there will be a maximum chances for 80 to 90% chances for a question related to sign and position. Okay, you can see any of the question paper. Okay, all over India, any question paper you take, AIMS NORCET or ESIC or any question paper. Okay, you will get one sure question from sign or position. Okay, this is 100% pakka. Okay, so coming to this question, there is a term which denotes purple discoloration which occurs in vaginal mucosa during pregnancy. The term is used, the term denotes is option A Gödel sign, option B Hager sign, option C Chadwick sign, option D Ladin sign. Okay, so the correct answer is Chadwick sign. Okay, so so let's move on to our next options also. See, if you see what is Gödel sign is shortening of cervix. What is Hager sign? Okay, in bimanual examination, one sign occurs, that is Hager sign. Please comment in comment box. Okay, what is mean by Ladin sign? I am so interested to know how you people are responding to my videos. So please comment in comment box what is known as Ladin sign. Okay, let's move on to the next MCQ. The safest position for women with cord prolapse in labor is. Okay, as I already told, sign and position are the most important topics as far as MCQs are concerned. Okay, so among that, this question is the safest position for women with cord prolapse. So you should know what is cord prolapse. What is cord prolapse? The presenting part. Okay, usually the head will be the presenting part. Instead of head, if the umbilical cord comes and touches the pelvis first, okay, that condition is known as cord prolapse. Okay, so there are many other different types of cord prolapse, occult cord presentation, like that. Many things are there. Leave that. Coming to the simple term, what is cord prolapse? The presenting part will be the umbilical cord. Okay, so you are in a labor room. So some woman is there who are doing a this one PV examination. That time you are noticing that cord is coming as a presenting part. What you will do? Okay, so in that you keep that woman in a one of the position. That position is option A supine, option B left lateral, option B right lateral, option D trend-lembar. Okay, so the right answer is trend-lembar. Okay, so if the cord is in presenting part, okay, if you should place the woman in trend-lembar position so that cord won't get compressed during contraction. Okay, one of the most frequent MCQ. Okay, in obstetrics or in position related question is position for cord prolapse is trend-lembar position. Okay, so next MCQ. Station +1 in labor indicates the fetus is at the level of perineum, at the level of ischial spine, at above the level of ischial spine, and below the level of ischial spine. Okay, so this is up to one of the frequent questions. Actually, I have made MCQs in obstetrics, okay, for this week. All the questions are not prepared by me, or I didn't take from any of the books, okay. These all MCQs came in exams which occurred in 2019 and 2020, okay. Except 2021, I have referred almost whatever question paper I had, okay. I took the questions from that question paper only. Okay, it's not from any of the book, or it's not from any of the sources, or I didn't make any MCQs. These all MCQs came in exam, previous exam. Okay, so coming to this question, station +1 in labor indicates the fetus. Okay, so the fetus at the level of ischial spine is known as station 0. Okay, so you should not get confused with +1 and -1. Okay, so if it is +1 means it is below the level of ischial spine. Okay, if it is above the level of ischial spine, it will be -1. Okay, so this is one of the most important MCQ also. Coming to the next MCQ, time of ovulation corresponds to. What is ovulation? The ova gets released, okay, and it is ready for fertilization. It is getting ready to meet with the sperm. Okay, that is known as ovulation. Okay, in that particular ovulation time, which hormone will be elevated? Okay, this is the question. Okay, progesterone level, blood level of LH. LH is luteinizing hormone is high, oxytocin level is high, or endometrial wall is sloughed off. Okay, so if you should know the basics of menstrual cycle. Okay, if you know the basics of menstrual cycle, this is so easiest question. Okay, so if you take menstrual cycle, one of the most important topic as far as MCQs are concerned, and if you get a thorough knowledge on menstrual cycle, you can answer any of the questions related to obstetrics and gynecology. Okay, so in this question, time of ovulation corresponds to blood level of luteinizing hormone is high. Okay, so let's take one quick view of a graph. Okay, so this is hormones and menstrual cycle. Okay, so you take 28 days as a menstrual cycle, a month's menstrual cycle. In that, the pink level denotes level of estrogen. Okay, estradiol. Okay, blue level indicates level of progesterone. Okay, and this green level indicates level of luteinizing hormone, and this yellow level indicates FHS level. Okay, so in this, what is ovulation? I already told. It is at the middle of the menstrual cycle, means 8 to 12 days or 8 to 14 days. Okay, this is my fertile period. Okay, in that fertile period, which level of the hormones are in high? Okay, if you see that luteinizing hormone will be high, follicular stimulating hormone will be high, and estrogen level also will be high. Okay, but in our option, what are there? Progesterone level. Okay, progesterone level will be high in which phase? See this graph. It will be elevated in luteal phase of the menstrual cycle. Okay, so menstrual cycle broadly classified into 3 categories. Follicular phase, where the follicles are getting means formed. Okay, means where the ova is formed. Okay, and transported. Okay, what is ovulation? I already told. The time of fertile period, when the ova gets ready to meet with the sperm, that is known as ovulation. And luteal means shedding down phase, or that after pregnancy phase. Okay, so this is the hormonal chart. So be clear with this point. In ovulation time, all the hormones except progesterone, it will be elevated. Estradiol will be elevated, luteinizing hormone will be elevated, and FHS also elevated. Okay, so coming to the next MCQ, The most important observation for a patient in labor in pitocin augmentation is, what is pitocin augmentation? Oxytocin. Okay. So the patient is on oxytocin infusion. Okay. The question is, the patient is on oxytocin infusion. Why they have started oxytocin infusion? For enhancing the uterine contraction so that the baby will be delivered. Okay. So the patient is on oxytocin administration augmentation, means they are enhancing the labor process. Okay. So as a nurse, what you do? Okay. Option A, monitor FHS, fetal heart rate, monitor TPR, monitor temperature, pulse, respiration, monitor and record the length of contraction, means uterine contraction, and preparing for emergency LSCS. Okay. So in this option D is not answer. Okay. Preparing for emergency LSCS is not answer, not an answer. So which thing you have to monitor? Monitor fetal heart rate, or you have to monitor pulse and respiration, or you have to monitor the uterine contraction. The correct answer is monitor and record the length of contraction. Okay, why it is important? Why you are giving oxytocin? To increase the uterine contraction. Okay, that's why you are giving oxytocin. So the answer is same. If you are giving a drug, you should monitor what it does. Okay, you are giving oxytocin to increase the uterine contraction. So during giving oxytocin, what you will see? Monitor and record the length of contraction. That is more important. Monitoring fetal heart rate is also more important. But when compared with fetal heart rate and uterine contraction is more important in monitoring oxytocin augmentation. Okay. So that's all about today's video. Okay. So thank you so much. So once again, if you are new to our YouTube channel, Nursing Update, subscribe our channel and press the bell icon. We are putting daily videos. Okay. Like our videos. Okay. And share our videos with your friends. Thank you so much. Good night.